Danny Mortimer. He's Chief Executive of the NHS Confederation, representing NHS trusts around the country. Good morning to you, Danny.
Good morning, Julia.
I really appreciate you joining us. A horrible death toll. Whatever anyone's views on how the government or anybody else should have dealt with this this horrific threat to us from the virus, that is a death toll that nobody will have wanted to reach. Sir Patrick Vallance, the Chief Scientific Advisor, said way back last April when asked about what would be a good outcome, what sort of numbers were the government sort of fearing and in terms of deaths, and he said that 20,000 deaths would be a good outcome, comparing it at that time to the deaths, typical excess deaths of 8,000 from a winter season of flu. Why do you think that we have seen 5 times that death toll?
It is, as you rightly said, Julia, it is very grim. And as you and I have talked in recent weeks, the picture from our members has been really grim indeed in terms of the rate of progress of the virus this time. There are a whole set of factors at play. We're a very different country to Australia and New Zealand, for example, in terms of we're a global transport hub. We're quite a densely populated country. We know there are underlying risk factors in terms of people's weight and underlying conditions. We have a slightly older population than many other countries, and clearly one of the things that we will need to understand is what difference patterns of lockdown make, and what difference also the ability to test and trace, and most importantly isolate people, is making. When I talk to members at the moment, that issue about isolation, the ability of people to afford to isolate or to access the help they need to help them isolate once they've come into contact with someone or had a positive test. Yeah. That's the particular area of concern for us and our members at the moment.
And some of those things, like test and trace, providing people with the financial means to isolate, because something I was raising as early as February last year, that people, it's all very well for people in PAYE jobs, staff jobs, having some time off paid, very different from millions of people who don't get paid if they don't go to work. Absolutely. And certainly can't afford to. That is within the government's purview. This stuff was raised early, but a lot of the stuff you went through there, a very long list in terms of us being an international travel harbour, obesity levels, density of population. A lot of that stuff is totally outside of government's control. Again, it's all going to come out in the years ahead. A lot of people we spoke to, really during the height of the pandemic last time round, when things were looking very grim early on, were saying to me, people, German epidemiologists and others, we were saying, well, what are you doing that's going so well? And they said, well, actually, we're going to have to let this play out for at least a year before we do know who's done well, who's done badly, because it's going to play out differently in different countries. It may well be that an awful lot of the things that led to that high death toll, for which the Prime Minister says he's sorry, he says we truly did everything we could, it may well be that even doing everything would perhaps not have prevented a lot of those deaths.
Obviously the kind of this latest wave of the virus is being felt in lots of countries. Germany and Poland, for example, are in as difficult and challenging a position as we've been in this last 6 weeks. There are some longer term factors. I think particularly the incidence of infection and harm and fatality in our poorer communities. Exactly the point you made about people who can't afford to isolate, where their health may actually be affected by the fact that they're not as well off as you and I. Those things are long-term factors, but those are things that the government can influence. And as we come out of the pandemic, and as hopefully as the vaccination programme, which is making such terrific progress, takes effect, as the disease hopefully comes under some level of control later this year, we need to learn lessons for the longer term about the inequalities we see that affect our health, about some of those longer term issues, so that this government and future governments can take long-term action. The NHS and our colleagues elsewhere can also take long-term action. There are some other factors. I think, that we have seen, I know you have covered the particular impact that the virus has had on social care, on care homes and residential care, particularly for older people. Again, I would suggest there's been a very long-term failure there for us as a country to address and invest in those services. And other countries have found ways to do that. That is something that's under the control of the government, perhaps not in the immediate term.
It's been mentioned by every government in the last 20 years that when I was political editor, and each time it's been, let's have a review, let's have a report, and then it's been kicked into the long grass. Let's talk about also NHS funding and capacity, because we spend an absolute fortune on the NHS, and whether or not people like the structure of the NHS or not would want something different to what we've got or not. How much money you spend on healthcare can have a very big impact in terms of outcomes, can it not? We know that Britain has, by a long way, fewer hospital beds, fewer ICU beds, fewer nurses and fewer doctors per head of the population, by a long, long way, than many of our fellow European countries that we would normally compare ourselves with. We see lower, worse outcomes for things like cancer, heart disease and many other diseases as a result of people's waiting for treatment and the lack of availability of hospital beds. And we are one of the few countries that has a crisis every winter. This is not the norm in other wealthy Western countries. Do you think that we need to have a little bit of a conversation with ourselves, not necessarily just with arguing with politicians, but with ourselves as a nation about how much we value healthcare and how much we need to pay more in tax to pay for it?
In simple terms, yes. I think that conversation for health and social care, as I said, because they're two sides of the same coin, really, in terms of supporting people's health, supporting people to live a good quality of life for as long as possible. There is a conversation there. Our experience as a nation is that we invest. Mr. Blair's government invested, Mrs. May's government invested, but in between those periods of investment, which tend to be for 5 or 10 years, it stops or it goes backwards. And the experience of other countries is that actually you've got to have a consistent level of investment. And what we've called for, particularly at the time of Mrs. May's announcement of investment, was that you do need something within government that is almost like an office of budget responsibility for health and social care that keeps track of what's needed and has that honest conversation with the public and with politicians about what's required. Okay. We're in a place where also the way in which we invest in the NHS in recent years is incomplete. So we'll invest in the services, but we won't invest in the supply of the people or the buildings or technology to help deliver our plans. And in particular, we need to find ways of investing longer term in public health. Those issues of inequality that we've touched on, those issues of those underlying conditions, which have been so material in terms of COVID-19. Yeah. We've also got to find a way of investing in those things longer term as well. So yes, there's a big conversation to have, Julie.
In terms of long term, what happens next? Big debate about how long this lockdown lasts. I'm of the view that this lockdown shouldn't be happening. Neither should the last one. The first one should have been seen. That's a debate that again I think is going to roll on for many years and will come out in the public inquiry. In terms of the validity of that, the evidence I believe is very much on my side on that. But a lot of people are very, very wary that this is now going to become the norm, and that when we see excess deaths, and we may well consider to see excess deaths from COVID every winter for years to come, even with a vaccine. We see deaths from flu every single year. There is new variants of flu every year. We have to adapt that vaccine. We don't always get it right. Some years we have five figures excess deaths from flu. Normally it's more like the 8,000 mark. But we are looking at possibilities. Not possibilities. This is now an endemic virus, and even with the vaccine we will see those deaths. The question is what we do about that. Chris Hobson, who's someone we've spoken to on the show many times from NHS providers, used to be a part of the NHS Confederation, of course, among the numerous bodies representing NHS organisations. He said a couple of days ago in a tweet, there is currently some loose talk of trading relaxation of the rules for acceptable flu level-like death rates. Principle of NHS is to avoid unnecessary deaths and do all possible to prevent avoidable harm. So real concern over concepts like acceptable death rates. That suggests to me that certainly NHS providers is of the view that there is no acceptable level of deaths of COVID and that only zero COVID is acceptable. That implies to me also a policy of locking down next winter as well. Do you agree?
I can't speak for Chris. You'll have to get him on and put the question to him, I guess. What we have seen with this virus is that the incidence of death is much, much higher than flu. The risk to people is much, much higher.
The risk to older people in particular?
The risk to
the risk to younger people, children, are at much higher risk of dying of flu than they are of COVID, which is the case, isn't it? Statistically,
yes. But overall, for the population as a whole, the rate of death from COVID is many, many times higher than it is from flu and pneumonia. And the excess deaths we've seen over this last year in the UK and in other parts of the world is much higher.
Yes.
The increased risk, it's a 1 in 100 risk of death by the time you get to 60. I'm not quite there yet, but that doesn't feel that old to me. It's 1 in 40 when you get to 70. Again, that doesn't feel that old to me, and it's 1 in 10 when you get to people who contract the virus in their 80s. So it is significantly higher than flu and pneumonia. You're absolutely right. We're all hopeful about the vaccine, but we need to see the difference that it does make, particularly in terms of severity of illness and its ability to cope with variants. There's obviously high degrees of confidence there, but we've got a long way to go with that vaccination programme. Our experience is that in the absence of our ability to test, trace and isolate effectively in previous outbreaks, the lockdowns have reduced patterns of infection, patterns of admissions to hospital and eventually... Well,
on a temporary basis, of course they do. The question is whether long term they reduce it.
And absolutely, the risk is, as we saw in parts of the UK in the autumn, that we lock down and then the virus resurges. We have to find ways of isolating people. We have to continue to roll out the vaccination programme to bring it under control.
Do those concerns imply, sorry, we're way over time, but do those concerns imply that we lock down next winter?
I think we're all... Again, we talked about this before, Julia. I think we're all very aware that we want to avoid that pattern of lockdown and then coming out of lockdown and seeing the virus resurge. The two best tools we have are the vaccination programme, which is being deployed at real pace now across the UK, in spite of the supply challenges that you've touched on earlier. And the second is a system of contacting and particularly isolating people.
Okay.
And that isn't just about contacting them, that's also making it possible.
I think you're veering away from answering the question, but I'm going to let you off because it is 7:20. Danny Mortimer, always appreciate you coming on the show. Chief Executive of NHS Confederation, representing this hospital trust dealing with this COVID pandemic. 7:20 is the time. This is